Good morning and welcome to the National Centre for Family Hubs webinar on working with dads and male carers to support whole family working. I'm Anna Bedford. I'm one of the Deputy Heads of Early Years and Prevention, and I will be chairing this morning's session. For those who have not attended one of our webinars, we are the National Centre for Family Hubs. This is a national learning platform that supports all local authorities to develop and implement a family hub approach. We are hosted by Anna Freud and funded by the Department for Education. We've got an absolutely fantastic morning planned for you to explore the work to support dads and male carers in whole family working. Next slide, please. So at Anna Freud, we strive to ensure better representation of the diverse voices of our stakeholders. We conduct ourselves with fairness and focus on equality and access to information and support for all. We proactively take an anti-racist and anti-discriminatory stance. We recognise that systemic racism and structural inequalities undermine our vision for every child to thrive. And we are keen to build a community of practice based on open dialogue that is thoughtful, sensitive, and brings value to all participants. So next slide, please. So this is the agenda for today. I'm just doing the introductions and I'll not be speaking for long to give plenty of chance for our speakers this morning. So this morning we'll be hearing from Anna Tarrant, who is a Professor of Sociology at the University of Lincoln, and she'll be talking about insights from the family hubs from extended research with young fathers and professionals. We will then hear from Jayne, Ben and Chris from Norfolk County Council, and they will be sharing the work that they've been doing on the Wellbeing Fund for fathers and fathers-to-be. Sarah Robson from Barnardo's Newcastle will discuss embedding systems and processes to embed father-inclusive practice. And Kieran from Dad Matters will talk about the service development over the last 8 years and the support that they offer to dads all over the country. And at the end, from 11:30 to 11:45, we'll have a section for Q&A. Next slide, please. So just to introduce Anna Tarrant is a Professor of Sociology at the University of Lincoln. She is a Director for the Centre for Innovation in Fatherhood and Family Research and a UKRI Future Leaders Fellowship called Following Young Fathers further, using qualitative, longitudinal and participatory research methods. Her collaborative research conducted with and for fathers and professionals in family-focused services is producing meaningful changes in real-world practice and real-time policy in the context of embedding an ethos of father inclusion. So I will hand over to Anna.
Thank you so much for that introduction, Anna. I realised that there's quite a lot of words in my introductions usually, which I think is perhaps reflective of the variety of different roles and things that I do. So well done for getting through that. Next slide, please. Yes, so as Anna said, I'm going to be talking about how we might shift towards a nationally embedded ethos of father inclusion. I'm going to reflect on my research with young fathers, some of which has also crossed over with the increase of interest in the family hubs around father inclusion and working more effectively with fathers. But introduce you essentially to some of the evidence base around existing work about what works in supporting fathers, and then trying to think about the implications of that for new contexts, the family hubs being one of those. Before I do start, I just want to give you a little bit of an insight into the image that I've used to open this presentation. This is a panel of young fathers that have been involved in our longitudinal research with young fathers. Some of them have been involved for over a decade. So what they really demonstrate here is that they're incredibly passionate. They really, really want to be there for their children. They overcome multiple systemic challenges and issues to be able to do so. And very often what we do, particularly with young fathers, is we assume them to be a risk and we paint them in a deficit, which our research has strongly troubled and countered. If you actually listen to the stories of young fathers, their life experiences, and here they're actually presenting about their lived experiences to professionals in a really professional way, but also an emotive way as well. What we see is just how powerful their contributions are. We learn what matters to these young men, and also that can help us then think through inclusive forms of practice and ways of engaging with them so that we hear the challenges, we recognise their contributions to the wider family, but we do so in a way that's based on care and compassion as opposed to risk and deficit. So when we do have these young men sitting in a panel together, as I say, it's a really incredibly moving and powerful thing to see. Next slide, please. So father inclusion in the family hubs. I just want to talk a little bit about kind of why this is an important thing. So the Family Hubs Start for Life programme have put support for dads and co-production more firmly on the agenda again. And actually the research that we've been doing, the Following in Fathers Further study, that began in January 2020, but built on a previous study called Following in Fathers that started in 2012. And we've been refining methods of co-production and co-creation. So that involves working directly with fathers and with professionals to develop an evidence base and to really think about how we then create new dialogues across the wider system in order to ensure that we understand what works and then we can embed that and develop that as a national contribution. We've looked at young fatherly support needs and how to involve them in service design and delivery, as well as capturing their parenting journeys over time. And I just want to make the point here that while we focus empirically on young fathers, again, what we're finding is that what they're telling us has relevance to a much broader, diverse group of fathers in general. So father exclusions or absenting, processes of absenting are systemic. And if we focus on those who experience or more challenges or for whom the challenges of navigating different social systems are amplified, that still has relevance for fathers in the round. The research responds to evidence that men as fathers experience a mix of support. So there are some really good examples of good practice out there already, but predominantly they experience sidelining or surveillance by services and the wider welfare system. So by sidelining, what we mean by that is that they are rendered invisible, if you like, in interactions with professionals. We often hear dads say, you know, professional had the back turned to me. They didn't ask me if I wanted support. We were sat in the same room and mum was shown how to clean and wash the baby, but I wasn't invited into that conversation. At the kind of more, I'd say more extreme end, there are elements of surveillance. This is based on a risk-based model, assumptions that dad might be a risk to the family context. We tend to see this more in relation to social work or issues where child protection concerns have been raised. And a lot of work is being done to explore how we challenge that idea, again, how we work with men who may present a risk in a way that they're supported and that we understand their interactions with the family, but provide alternative ways in which they can move forward that are beneficial to the wider family context. I'm going to talk a little bit about, in this talk, about some of the methods that we've been refining through the project for engaging fathers in processes of service design and delivery. So I'm going to talk about a particular model, which is the Young Dads Collective, which we've been replicating in different areas of the UK. But my hope is in sharing that model that you can extrapolate kind of insights about what works for the family hubs context. And certainly our work has crossed over with the family hubs more recently, particularly in the northeast region of the UK. And what we've seen is that the methods for working in co-production with young fathers has proven really innovative and transformative for the lives of those young men, and then also for the delivery of services. And we've also been involved in an evaluation of the County Durham Family Hub, and their commission service offer for young fathers. So again, a lot of the information today speaks to some of that work. Okay, next slide, please. So just in terms of some of the research background and some context, so social sciences research has focused on the value of father involvement and father engagement. And these are two particular concepts that underpin, I think, a progressive focus on father inclusion and the ways in which that can have benefits for the wider family, for women, for children, and for men themselves as well. Now, there's a gender equality element to this. So for me, father involvement leads to and helps us to unstick what's been called the stalled gender revolution. So what we're seeing more generally is that gendered shifts in men's participation in the family haven't fully matched women's participation in the labour market. But having said that, there are cultural shifts, and we are seeing men's engagement in family life rising and increasing. So the Fatherhood Institute here provide some statistical evidence that post-pandemic fathers are doing 18% more childcare. And there's a much wider range of evidence demonstrating that men want to be there for their children and invest more in their family identities. There's a whole range of literature, interdisciplinary literature, not just from the social sciences, but also the sciences as well, that has evidenced the benefits of father involvement for children's social, emotional, and educational development. So not only is involving fathers about and supporting father involvement as a society about progression towards gender equality, but it also addresses intergenerational inequalities as well. And again, we know that fathers want to be involved in their lives. It's increasingly become a cultural expectation that fathers are more involved in their children's lives, but some have less resource to be able to do so. And young fathers being an example of that. So father involvement is a typology or a framework that's been developed by academics to explain fathers' commitments to their children. And again, the attention here is to fostering the benefits of relationships within the family. So positive father-child relationships and also mother-father relationships. And this refers to any sets of relationships. So it might be that the mother and the father are no longer together in a relationship, but if we can support them to co-parent across households, then in theory that results in stronger well-being or strengthened well-being for family relationships. In the context of service support, the language of father engagement has become more prominent. Now, this area of research is about or pays attention to father and family relationships with professionals. So whereas father involvement is about in the family, father engagement is about the relationships family members have outside of families. So we're focusing here on their relationships with a broad set of social welfare contexts, education, employment, housing, any interactive system that a family will work with or engage with in order to resource themselves. And increasingly, it's also being applied to considerations of how we build towards more father-friendly or inclusive service design and delivery. Again, this is an international agenda. There's been a lot of work in the US, particularly around how we create father engagement and create the context for father engagement. And this is increasingly something we're thinking more about in the UK as well. Next slide, please. What has been reported on in the literature is that there are a number of barriers to father engagement. So more generally, a primary focus on mothers has been identified, and also challenges in properly engaging fathers, especially in child and family welfare contexts. So again, as mentioned, fathers are underserved across the entire welfare system. And I want to make the point here that when we're thinking about men, what we're talking about is men as fathers. And I think that's a really important distinction, particularly if we're looking at this from a feminist lens, where men are privileged in a whole range of different areas of welfare. So we're focusing here on men as fathers or as caregivers, which is where they actually do experience a bit of a deficit in terms of the support that they receive. research has focused on professional support for fathers and the challenges that professionals experience in trying to do father-focused work. And a number of different barriers have been identified. So this includes men's own perceptions and responses to services. So we hear from both men and from professionals that there's a distrust of services, and men fear a worsening of problems. So if they're to disclose that they're having challenges, they fear what the repercussions of that might be for them and for their relationships with their children. There are examples of gendered ways of thinking about fathers, so traditional gendered ways of thinking about fathers in service contexts, so positioning them very much as a secondary parent rather than a parent in their own right. And where there's an acceptance of those stereotypes, there's a risk that it becomes assumed that they're disinterested in parenting. And again, research across the board about men as fathers really strongly counters that idea. At a systemic level, there's a limited, or there is limited access to training and reflective supervision for professionals. We see constraints on workload capacity, and in the last decade in particular, period of austerity, that's become increasingly the case. Although I will make the case here that work with fathers should not be an add-on. This is something that should occur just as part of everyday practice. But nevertheless, the way in which systems services are set up, that often works against that ability to do that work. As mentioned, the level of need that a father may have may be readily translated into deficit assumptions, and sometimes that might be driven by unconscious bias. There are sometimes elements of maternal gatekeeping, so where mums may not provide information about dad, and or don't necessarily recognise themselves that a dad may be have a positive influence on their child's life. And also more generally, if we look nationally, access to specialist support services for dads is a bit of a postcode lottery. So because of the way services are funded, pots or areas of innovation kind of get stymied, if you like, and the learning that can create for mainstream services kind of is constrained. But again, I think the family hubs and this kind of broad national agenda to think about father inclusion creates a real opportunity for us to think about what innovations can happen, what has worked in the past, and what might work in current models. So my question that I pose here is can we and how do we avoid replicating some of these issues in the family hubs? Next slide. And for me, father inclusion, or the language of father inclusion, is something that we can all work towards and commit to. And it might be translated in different ways, in different contexts, but actually that's the power and the value of this kind of ethos and this kind of way of thinking. I've been really fascinated by looking at existing literature about father engagement and involvement, that father inclusion crops up, and we certainly hear it in our research with professionals as well. But when you actually try and dig down and drill down to what it actually means, people have varied perspectives on that. I think perhaps it is most basic. It's about how do we include dads. But this is an under-theorised and under-settled concept. So increasingly I've been thinking about it, and some of the sociology here is that it's actually a bit of a sensitising concept, and I quote Bloomer there. But at its very simple, what I mean there is that we're including fathers as an idea is something that multiple actors can work towards and translate for their own practice and context. Again, a lot of this is driven by a broader research question that we've been trying to follow up through our work in following in fathers further. And that question is there value in creating a national practice and policy ecosystem that is father inclusive? And again, what might be the role of family hubs in promoting and embedding this idea? And I think what you'll find I'm trying to get towards is that we actually need more cohesive policy right at the top to match some of the cultural shifts that we're seeing within families, and then to provide the support and the context that are required to be able to be father inclusive, to address the barriers that professionals are reporting. Next slide. So we've been using participatory methods through the Following in Fathers Further study, including co-production and what I refer to as co-creation. So in doing that, what we're doing is we're bringing together fathers and other stakeholders to address their marginalisation across multi-level systems. So that's in families, in practice and policy. This has been refined across the programme. So initially, we actually started with a period of co-production where we engaged with young dads and service professionals to capture some of the information about what matters to them, both in terms of lived experiences of fatherhood and then in terms of what works in providing father-inclusive support. In a follow-up study that took place 2016 and 2017, we tested some different models of good practice. So we worked with somebody in the criminal justice sector to follow up with young fathers when they were coming out of prisons and then resettling into the community. She provided really holistic and individualized support for those young men and help them to secure all the things that they needed to establish themselves more independently when they left the prison system. And we also developed the Young Dads Collective model, and I'll talk about that again in a bit more detail after this slide. But over time, we've shifted to this co-creation methodology. So that's where we've used or been supported by research and that process and that funding to co-create specific social interventions that are designed for fathers and to support fathers around father inclusion and also to promote father inclusion. But these methods are useful because they help us to address what is kind of a general but very complex challenge that surpasses the capacities of any single actor. And again, I think the introduction of the family hubs has helped us to recognise that individuals on our own can't make this change happen. We need to work collectively. We need a shared language, and we need to have dialogues in order to promote and advocate for this kind of approach and its value and benefits. Co-creation is a form of collaborative knowledge generation, so it involves academics working alongside practitioners and communities to generate and promote new knowledge and/or to co-instigate or create new interventions. It's an approach that's increasingly popular actually in research and service development. So we're seeing quite a lot of this work happening in public health. So again, there is potential in mainstream services for this to be able to work as well. And what we do with this process is we engage in action research cycles. So we actually generate evidence about the process with professionals, with dads as it's occurring, and then we create new iterations or adaptations of the intervention that we've created to ensure that it's context specific and it actually does respond to the needs of local communities and professionals. So it's very much it's a challenging process, but we're feeding evidence into that process the whole time to inform our decisions and to make sure that what we're creating is of value to those who are involved in it. And next slide, please. So the model we've been testing, if you like, in the last sort of 8 to 9 years is something called the Young Dads Collective. Now, this in and of itself is an intervention that's based on co-production. So what it does is it involves young fathers in training an audience of multi-agency professionals who are then encouraged to adapt their practice, having heard the young men's accounts. And again, what this model does is it supports social transformation at various system levels. So it supports the individual development of young fathers. So they're become part of the process and are recognised as experts by experience. And they are trained to talk about their experiences of being a dad and engaging with services. What we've seen throughout the process, and we've instigated 2 models of this. It started in London originally, and we've taken it to Leeds and also to Grimsby, is that it engages them in, well, it supports them to build their confidence, and they build new skills as well. And actually, following the creation of the model in Leeds, 3 dads went on to secure employment. So they're able to say, you know, we're involved in this research process, seeing that our identity as fathers is important and is recognised, has given them the skills and the confidence then to transfer those skills into the employment market. The intervention creates opportunities for peer support. So the young men come together as a community with a shared identity. They really come out of their own shells in peer support, and you'll hear that from some of the other presenters today. But again, being able to talk about being a father initially and working with them longer term really helps them to open up about some of the wider challenges that they have, and they start to build trust in the process and in support. It addresses gaps in professional education and continuing professional development. So the young dads speak to professionals, and these are multi-agency professionals. They're encouraged to think dad, and we also ask them to make pledges for practice change as well. And then in terms of policy change, this is always going to be one of the hardest things, I think, for us to affect change in. But the model creates opportunities for young dads to speak to policymakers. And we've had young dads speaking at policy events, national policy events, but also regional policy events as well. Encouraging services and to include dads more effectively, and then to encourage father inclusion in service design as well. This is talked about in a couple of reports that we wrote at the time. So there's an image there of how we learned to support young dads. That's available online, and I can provide a link to that after the event. Next slide, please. So just some of the feedback from the research that we did alongside creating this intervention. So if you could click for me. So one of the co-creation partners says, look, this work from this project has highlighted the professional anxieties and gaps in practice when we need to be engaging with fathers. So we know there's a problem with professional practice. There are anxieties around how we engage fathers. This has helped them to think about it more. Next one. The young dad from one of the young dads from Leeds says, buzzing, love being listened to. It's not just the work with the professionals, it's about meeting with other dads when we do the planning. We all want other dads to have a better experience. So again, not only does this support them, but it creates advocacy for young dads and father inclusion more generally. Next one. A professional from one of the events said, thank you for your delivery yesterday. It was extremely useful to our organisation. On returning to the office, I had a case discussion with one of my team. We discussed the worries that mum has and the difficulties in the case. We mapped our worries, and then I asked what dad's thoughts were and does he support the family? And how does he support the family, sorry? Are there any family members on his side of the family? The reply from the service was that dad's not really in the picture and doesn't really have much involvement. I asked if dad had been spoken to, and the reply was no, as I don't think mum wants him involved. So this is an example of maternal gatekeeping, potentially. I reminded him, though, that what training she'd just attended, and she had a penny drop moment and said her first task was to contact dad and discuss the case with him and explore the wider family network. So again, in this case, it'd been taken at face value that dad might not be involved and might not be interested, and the training really prompted her to change that practice. Next one. At the top level, policy level, so the YDC model recognises the importance of fathers in keeping children safe and has provided an opportunity to include men and dads in local conversations, both strategically and operationally. So this is regional policy change. The credibility of the model and the research, its preceding studies have enabled us to advocate for a more equitable policy and practice environment. Since the project was launched, there's been a shift in the number of accessibility of advice, activities and services for dads of all ages. So again, we're starting to see regional changes in that broader support environment, so both the social and medical context. The training for professionals, the process of promoting and championing the project have contributed to improvements in the strategic and operational environment in Grimsby that have a positive impact on families' lives. Next slide. And this is just a picture of, this is the Young Dads Collective North, but again, it's so powerful bringing them all together. Next slide. I'm conscious of time, so I'm just going to whiz through this last few bits. As well as creating social interventions, we've also been doing some really creative work with our young father beneficiaries. So with the North East Young Dads and Lads, I'm now chair of trustees for that charity. It's an incredibly innovative charity. Specialist support provision for young fathers is provided. But with them, we've created a father inclusive toolkit for professionals, features imagery of the dads. We've got a snakes and ladders picture of some of the challenges and some of the things that support young fathers and the kind of contingency of their parenting journeys over time. And it encourages professionals to think about those things again in a way that's caring, compassionate, and supports more of an inclusive approach. But they absolutely love this work. We have them voicing over videos, they get filmed, and it really builds their skills. Next slide. They've also created something called DigiDad. So this is an online e-learning program for young fathers. Professionals and young dads can sign up to that. The dads speak to a range of different themes about childcare, about health. There are courses on there around first aid, and they can also get certificates that are signed by myself. based on little quizzes, and should they need to then demonstrate their commitment to their children, particularly if they're engaging with the courts, then they get some evidence of that engagement and some proof that they want to be there for their children. We've also set up Ambassadors, which is a new Young Dads Council. Again, this is a model that's similar to the Young Dads Collective, but we work with dads on a monthly basis and we train them around father inclusion and how to speak about father inclusion to professionals. Just last slide, I think. I've got a slide there on what works and what we've seen in good practice, and I'm going over time now, so I'm just going to be really quick. But again, you can look at the slides and follow this up afterwards. But there is evidence about what works. It's not all doom and gloom. So working with fathers through co-production is incredibly powerful and transformative. It needs to be based on effective relational work built on trust, on parking professional judgment, and also accessing training for CPD as well. There's importance around thinking about multi-level approaches, so how we champion at the levels of commissioning, design and delivery, and also policy. And I think we also need to think about the journeys of fathers through services as well. And Fitzner et al. Talk about getting, engaging and keeping fathers. So part of that is about training staff in father inclusion. In the family hubs, we've learned that even the receptionist, the person who welcomes someone into the service building, needs to understand dads. Using positive inclusive imagery, collecting data, ask if men are dads, and also conducting or getting someone to conduct service audit and evaluation. Right, last slide is just, just some resources. Again, you can follow up on those later. But yeah, I'll stop there. Thank you for the time. Thank you.
Thank you so much, Anna. And it's so interesting hearing about that co-creation within research and how we're seeing that in that service design. If you've got any questions following Anna's talk, please put them into the Q&A section. But we'll be moving on to hear from Norfolk County Council and how they've developed a wellbeing fund for fathers and new fathers to be. So I'll just introduce the speakers. So we've got Ben Dunne, who is a participation officer. And Ben focuses on embedding family voice in the development of new services across the Start for Life and Family Hub network. Ben's role includes facilitating Norfolk's Parent and Carer Panel, which is a diverse group of parents and carers who help to develop services that are more accessible and meet the needs of families across Norfolk. And Jayne, we've got Jayne Billman. Jayne Billman is also a participation officer, and her main focus is to support the development of Norfolk Parent and Carer Panel, and Jayne is passionate about inclusive practice and seeking opportunities to join services, working with partners and key stakeholders. And also we've got Chris Samuels. So Chris is a member of Norfolk Parent and Carer Panel and has been involved in the project from the beginning. Chris is an important member of the panel and has spoken at Norfolk County Council's Working Effectively with Fathers Conference. He's represented the panel during recent ministerial visits and has taken part in media promotion, met with commissioners and has awarded funding, which we'll hear about during their talk, to Voluntary Community and Services Group. When Chris isn't supporting the Parent and Carer Panel, he can be found running his pub in West Norfolk and looking after his two lovely children.
Thank you, Anna. Thanks ever so much. We're really excited to be here today to tell you more about our co-produced Wellbeing for New Fathers Fund. So if we could have the first slide, please, and move on just one more. Wonderful, thank you. Well, as we know, it's increasingly recognised that new fathers experience challenges to their mental health, and that for some, becoming a father could be a stressful and it could be an isolating experience. Research tells us that 10% of dads, so 1 in every 10 fathers, experience postnatal depression, and up to 15% of dads experience anxiety during the perinatal period. So what the studies are telling us is that men face challenges to their mental health during the perinatal period, just like anybody else. But perhaps one of the big differences is that they just don't talk about that enough. Mark Williams, in his report, Why Dads Matter, tells us that there's a pressing need for more support services for fathers across the UK, enabling dads to reach out and build local support networks to share their worries and share their concerns. As a local authority, Norfolk County Council is fully committed to father inclusive practice across its services. This has meant it's been a natural step for us to do our very best to embed father inclusive practice across our Start for Life and our Family Hub approach. Alongside this national context for increased levels of support, Fathers on Norfolk's Parent and Carer Panel, which is a group of parents and carers who work with us to sort of improve and develop services for families with children under 2 in Norfolk, they've consistently provided feedback to us about the need for more bespoke support services for fathers that will help dads to prepare for parenthood, that's sort of both practically and emotionally, support positive mental health through the perinatal period. And they've also really stressed the need for local accessible services, particularly as Norfolk is a huge and it's quite a rural county. Okay, so the next slide, please. To bring the ambition to life, we work with our Parent and Carer Panel, particularly our dads, to co-produce the Wellbeing for New Dads Fund. The value of the fund was £140,000, which was made available to voluntary community sector groups across the county to deliver wellbeing interventions and outcomes for fathers in the first 1,001 days, so from conception to the second birthday. Co-production is really at the heart of how we work with the Parent and Carer Panel here in Norfolk, and our panel members were involved in the planning and the delivery of the fund from the very beginning. This began with co-producing the criteria for the fund. Our dads highlighted the need to fund projects that can bring dads together to build networks of support, as well as new opportunities for fathers and their children to engage in activities and build strong relationships together. The next step was to get out there and to promote the fund, and which our dads were hugely active when it came to this part, featured in local print media, they featured in social media as well. They also took the fund out to their local communities to ensure that we were doing the very best we could to sort of push the fund out to all 4 corners of the county. And this led to over 20 applications from charities with a combined value that exceeded the total of our fund, which meant that we had some really difficult decisions to make when it came to awarding the money. But very fortunately, we had dads with us to help us make those difficult decisions and award the Wellbeing Fund, which was supported by the Norfolk Community Foundation. In the slide here, you can see a photo of us in action. And 2 of the dads that joined us were Chris, who you'll be hearing from next. He's going to tell us a bit more about his experience. And Jonathan, who told us that I'm immensely proud of my involvement in the dad's funding process and sincerely hope that this much needed financial support can help many local groups and charities and fathers across the region. Our panel members, our dads, will also be going out and visiting some of these funded organisations to get a feel for the difference they're making to fathers and fathers' lives and to their families. And also, hopefully, we'll find a way to recruit some more fathers to our Parent and Carer Panel at the same time. But next, I'm going to hand you over to Chris, and Chris is going to tell us a bit more about his experience as a member of our Parent and Carer Panel and what this project's meant to him.
I joined the Parent and Carer Panel through frustration, through being unhappy with my experience while my son was being born in the depths of the pandemic, and I missed out on going to scans, I missed out on the birthing plan, I missed out on appointments with midwives, because as soon as COVID came along, it's like, right, this is all about mum. Dad doesn't, it is a spare part for when it comes to pre and in fairness, post birth as well, that I just wasn't important. I wasn't needed, so I was extra. And that left me really frustrated and kind of excluded from the process. My wife suffers with multiple sclerosis. She had a relapse very shortly after giving birth, and I was thrust with, here is a 4-day-old baby, have fun. And we'd had no classes because they'd all been cancelled through COVID, and I had no idea. And I really enjoyed my job as a brand new dad. It brought me tremendous joy and happiness. but it came with a lot of responsibility, and it is petrifying, and it is frightening. And I muddled through, as we do, as new parents, and everything you do is frightening. As my son grew older, we went into second lockdowns and things. My wife fell pregnant with my daughter. And it was shortly after my daughter was born that I saw an advert asking about the Start for Life offer and things through a Facebook advert. I had no idea what responsibility county councils had to children preschool. I just assumed that, there's vaccinations, there's midwife appointments, and then you wait until they go to school, and then the council start looking after your child for 30 hours a week in a school environment. So I joined it through curiosity and through frustration or anger, I suppose, is probably the right sort of the terminology for motivation of me joining the panel. But since joining, I have been so privileged. I have been involved in videos, so my face is on I'm featured in videos on the Just One Norfolk website for infant feeding, because with my wife being very unwell, I had to learn how to feed my baby at 4 days old with not really having a clue of barely what way up he went. I've spoken, I think it was mentioned in my introduction, I've spoken to Safeguarding Children by Working with Fathers conference, which I was part of a panel of 6 fathers, all of whom had faced various different adversities. Myself with my wife being disabled, but there were fathers who had very limited access to children, fathers that had faced uphill battles in court. One of the things that was so reassuring from being part of that was actually that the engagement we had from the people that attended the conference was really positive, that people appreciated that dads don't necessarily always fit into a single group, I suppose, or a single demographic, but across those differences, we were all united in wanting to be the best parent we could be, and that sometimes it can be difficult. You feel like you're fighting against this invisible wall that prevents you from being the best parent you can be sometimes, especially when you're interacting with services and you feel superfluous. I've also featured in breastfeeding support videos, which seems weird from a dad point of view, saying, well, but dads can be involved in breastfeeding too. That sometimes, that's breastfeeding is very much mum focused, but we're there. Dad can be part of it. I've done safeguarding videos. I met with Dame Andrea Leadsom, who at the time was the Minister for Children and Early Years, and spoke to her about the difficulties of being a rural dad. I live in the middle of nowhere, and it's so important for me to be able to share that. Say that the one-stop shop approach is brilliant. It doesn't stigmatise people for needing various different services. However, in a county that's 60 miles across, there are challenges in Norfolk of having one-stop shops, or a one-stop shop certainly, that you need quite a lot of them. And then my sort of proudest achievement of all on the panel has been my involvement in the Funding for Fathers project, that we had some brilliant, innovative ideas. We had everything from bacon butties and conversations in a Methodist church, right through to art projects, outreach with music, allotments, such a wide variety of projects that people have submitted to the panel. It was one really tough job to divide up and go through the funding applications and decide who was the most deserving, because all the projects were really, really encouraging. And it's been a tremendously fulfilling process for me to be part of the parent and carer panel and have the opportunity to do so many different things and really benefit the lives of lots of children and fathers and families as a whole across Norfolk. Thank you very much.
Next slide then, please. Hi. Yes, so bear with me a second. So as referenced by Ben earlier, you can see from this map that Norfolk is a large but also very rural county. It's approximately 2,074 square miles with an approximate population of 931 12,943, it is the 4th largest local authority in the UK. The number of open referrals to the perinatal mental health team in the Norfolk and Suffolk Foundation Trust averages monthly at 555, and around 15%, that's roughly 84 of those, are fathers every single month. We met with the parent and carer panel to ask them about the kind of projects they felt would be best to fund, and they told us they wanted to see a range of themes to encourage dads to get involved, such as sports themed, arts or crafts, and each project could apply for up to £10,000. So the dads agreed on those who met their criteria, which was co-produced and which offered a vast range of support for Norfolk's dads, gave the best value for money, and was spread across all county, which is 7 districts. Some of the projects chosen were projects that helped dads prepare for fatherhood, swimming pool-based father and child activities, projects which reduce isolation and loneliness of dads, a community allotment and orchard site where dads can grow and nurture fruit and vegetables with their children, fathers and babies engagement in creative music and arts. Some of the projects are attached to the local church. One project is attached to Norwich City Football Club and appropriately named Dads United. Some even make it all about the bacon sandwiches. Next slide, please. Spotlighting one of the projects which was awarded the funding is Dad Vengers, a national organisation which Norfolk are very proud to collaborate with. Here is a short video of Nigel, the founder of Dad Vengers, providing an overview of the 4-week online course for dads to be.
Hi, I'm Nigel, founder of Dad Vengers, and you are here to check out our new dad course, which is awesome because it means that you are striving to be the best dad that you can be, and we want to help you with that. But I realise that there must be questions about the course that you have, so hopefully this video will clear them up. So what is the Dad Vengers new dad course? Well, it's a 4-week online course where we go through all of the things you need to think about when you're becoming a father. Now that can be anything from supporting your partner, to what to expect in labour, to looking after your mental health, bonding with your baby. There are loads and loads of things. Now the thing is, I could sit here and talk about this course until the cows come home, but what I think might be more beneficial from you is hearing from some people who've actually been on the course.
Before doing the course, I felt quite apprehensive about becoming a dad, although very excited as well. Definitely was looking forward to it, but there were lots of unknowns and things that I didn't know, what to expect. So yeah, it was really helpful doing the course in order to get a bit more confidence prior to that time.
The best bit of the course was the small community we built and just the small group chat we had every week. So I think just having that time and space dedicated to having the conversations about what to expect about being a father, that was the best bit for me.
Of course, I definitely feel confident now, and I actually feel ready, which is it's a bit scary to say really, because I'm sure I'm not ready, but but I feel ready. I feel excited actually. I feel confident and happy, and I feel like also a good thing is there's a support network of people that I didn't have before the course. Definitely, everyone who's been on the course, there's always that Instagram and the WhatsApp group we've got, and we can just bounce things around. And I think that's something that's really helped my confidence. Actually, I feel like I've got a new group of people to talk to, which is really handy.
I would 100% recommend the course to other expectant farmers.
I would definitely recommend the course.
Definitely recommend the course to any father, and I think it's a thing that I don't see a situation where it wouldn't be a good idea to sign on and give it a go. It's helped me so much.
So there you have it, straight from the horse's mouth. You can see and hear just how valuable the people in the course have found it, and you will be just the same. So if you have any questions, get in touch, but if not, sign up for the course and we'll see you soon.
So thank you for that. And yeah, that brings me to, so what's next? We have been exploring creative ways to measure and capture impact stories, and we're currently developing a voice bank, which will provide a verbatim account of service user experiences. We are literally lifting the voice from the page to the speaker, making listening much more powerful than the written word. We're bringing the funded projects together to form a community of practice in October, which will provide opportunities to network, share practice, and learn from each other. We've already hosted a meeting with some of the teams from the organisations which were funded, and they told us that they would like to meet face to face to better understand the work of each other and how each organisation is supporting fathers, to share updates on progress, successes and challenges, what have been the barriers or the threats, to better understand the wider system of support for fathers' wellbeing in Norfolk across statutory and commissioned services, as well as across the voluntary and charity sector network, enabling a more joined-up approach to sharing knowledge and signposting, and to build professional networks and identify opportunities for greater collaboration and sharing of ideas, building on sustainability of the work and the legacy the dads on the panel have created for fathers in Norfolk. Thank you so much for listening today. We hope you found our presentation helpful and insightful, and would be happy to answer any questions that you may have.
Brilliant. Thank you, Jayne, Ben and Chris. It was so, interesting to hear about the experiences, particularly from Chris, of being involved in the process and what's been achieved so far. And we'll all be looking to see what's happening next, and from those evaluations. But thank you. And as you were saying, Jayne, if anybody's got any questions, and I've seen some that are coming into the Q&A box that we should have time to get to at the end. But we'll move on now to Sarah Robson. So Sarah Robson is a father and male carers enhanced service coordinator with Barnardo's, and funded to deliver the fathers and male carers enhanced service in Newcastle. The service offers a strategic focus on embedding father and male care inclusive practice citywide. Their role is to help and support partners across the community family offer to develop and improve accessibility for fathers and male carers.
Thank you so much, Anna. Good morning, everyone. Next slide, please. Thank you. I think Anna has given a fantastic introduction into the work that we are doing. I came into post in April of 2023, and the contract has changed and developed as we've gone along. A lot of that's been based on learning so far, and just listening to everybody talking this morning so far. I think what I'm going to talk about today echoes that, which, it's a national challenge, but it's also an opportunity for national development. Next slide, please. So I started my role with a consultation. I was speaking with professionals, I was speaking with dads, I was speaking to anybody who would speak to me about fathers and their experiences. And what did we learn, and how was that going to inform my practice going forward? So dads were consistently telling me, as you've already heard this morning, that they weren't feeling heard or included. They didn't feel that community spaces were for them. They weren't receiving information about their child. And quite often I was hearing the word powerless. And also feeling there was a gender bias and a stereotype when we talk about gendered parenting roles. Professionals were talking about services not being well attended by men. We're putting groups on, we're trying different things, but we just can't get them in, is another phrase that I heard quite a lot. Dad's details not being captured because from the point of pregnancy, and I think Chris touched on this before through his experience, mum is the patient, so all of the records are kept in her name. Systems are not set up to capture more than one parent's details. It's difficult to find out who dad is, and we've already touched on maternal gatekeeping. Mum's not wanting wanting services to know who dad is, but also not wanting dads to know that services are involved. And we also looked at a rise in infant deaths in the northeast of England, and a deep dive into that. The evidence was that actually quite often these babies were out of routine, so they were not with their primary caregiver, so they might have been staying over with dad, and dad just didn't have that information around safe sleeping, which made me really uncomfortable about the language of a perpetrator, because actually they were uninformed. On the positive side, because it all sounds really bleak, the feedback that we're receiving was when it works well, When dads engage and when the offer works for a father, the outcomes are phenomenal. So this evidences our practice that we could be doing this in a wider context going forward. Next slide, please. So listening to dads and listening to professionals, what do we need to do to get it better? We want to empower dads. That's what they want. They want information. They want tools to feel that they are capable and they are valued. We want dads and male carers to feel heard and included. We want them to feel welcome in our services. We want them to know that our services are a universal offer, but also to recognise the specialist needs for some of the challenges that dads are up against. And we want dads and male carers to have easy access to information to support them. Thank you. Next slide, please. Some of the areas that were focused really closely on, the first one was safeguarding. So going right back to 2007, and we think about the case of baby P, which everybody is really quite familiar with. The recommendations of learning were that we need to listen to dad. Dad was not heard, dad was not included, he was not assessed as a viable carer. He felt shut down, he felt sidelined by services. We're also thinking about foggy consent, especially with maternal gatekeeping. You know, professionals talking about, well, do I contact dad? I don't have consent to do that. Do I definitely have dad's details, or do I have no details for a father at all? And weaponization of children. This is a real kind of power balance between mothers and fathers, and thinking about the emotional impact on children growing up. What information are they receiving about their dad if their dad is vilified by maternal family, and the emotional impact on fathers as well, and the impact on their mental health, and equal access to information and services. So when we were thinking about that, we were thinking again, mother's the patient, the records are all with her, they then move over to babies. So somehow dad's name doesn't follow that child through their life within our statutory services in the same way. Spaces and places being equipped for men and their children. I talk about toilets an awful lot. So do you have accessible changing spaces where men can change their baby? Do you have a space where a man can take his little girl who needs the toilet and not feel that he's taken up a disabled space? Because we were hearing that as well. They don't want to take from other people, but they equally don't feel that they are provided for themselves. Lots of other things within the community family hubs that we looked at to make sure that they were inclusive, that they were welcoming environments for dads to go into. And equal rights, gender equity, and I know Anna touched on this before, but society is changing. We are seeing dads at the school gates, childcare is changing, but society's not changing with it. So we want to really sort of challenge some of those gender stereotypes in parenting roles and keep up, so to speak. The mental health and well-being of dads, we've talked about that an awful lot this morning. You know, the paternal stress after baby's born, the stress factors, the anxiety, and father and male carers' well-being in the workplace. I was asked the question about somebody revising their sort of contract offer for men who they employed who are fathers, and I was thinking of all these different things that you can consider, and then I thought, what would you do for a mum? Next slide, please. Just to give some context to this, I kept on thinking, what is the thing? What is the thing that we have not tried? I would suggest things and people would say, we've tried that, it didn't work. We've tried that, we had low attendance. What is the thing? And for context, when we talk about, oh, we have a nice little group of dads coming in, we might have 4 or 5. We found out in April of this year that there are 19,122 children aged 5 and under living in Newcastle. Now, that is a lot of little people. So the question is, where's dad? Which led me to think we don't actually know who dad is. And a lot of that goes back to our systems and processes and where and when and how we capture dad's details. Next slide, please. So we started to think about a system and process change. We started to think about all of the different places that we need to embed a different way of working. What guides and restricts our practice? Quite often people were saying, you know, the policies behind our delivery is that we will only work with the resident parent. Systems change, what can we influence? What can we change within the services that we deliver? And how do we enable and evidence the engagement with non-resident parents in a meaningful way? So not tokenistic, not I know who dad is, because do you actually know who dad is? You might have his name, but have you contacted him? Have you spoken to him? Have you included him in what's going on with his children? Contract monitoring. To be contract compliant, what does whole family working look like in practice? We talk a lot about whole family working, and community family hubs are for families. Yet there's a certain amount of accountability to make sure that we're including fathers in that. And going forward, that needs to be the universal offer. And that is something that Newcastle is really striving for. Case management and auditing, another opportunity to look at what does our delivery actually look like? What are we capturing? What are the outcomes that we're hitting? What can we change and what can we learn from? Next slide, please. The tools that we use, quite often, I am absolutely guilty of this. In previous lives, in my work life, I have been a caseworker, and you go out with a form and that's your visual prompt, and you come away and you go, that's all right, I've ticked every box, I've answered every question. But have we? What do those boxes actually ask? Because these are the prompts for practitioners who are quite often so busy at capacity and just thinking, oh my goodness, I'm already 15 minutes late for my next appointment. Quite often just having something visual in front of you is really helpful. Risk assessments, and I'm going to go back, but also talk about risk assessments, but being really clear with the people that we're working with, what we want to know and why we want to know it. And where does that come into risk assessments? We talk about maternal gatekeeping. We talk about professionals are saying the mother doesn't want to share the information about the dad. She's saying he's a risk. She's saying he's done this, he's done that. She doesn't want him involved. If dad has done all of those things, it's really important that we know who he is so we can risk assess and protect the mother. And if we explain it like that, then we have an opportunity to unpick what's actually going on. If it's not the case, we then can talk about the benefits to the children, to the wider support network of knowing who dad is and including them. And feedback tools, who are we sharing them with so that we can continue to learn and adapt. Community family hubs are a great opportunity to share information and learning across services, and we can utilise that. We can utilise that going forward. Next slide, please. Staff induction and support, embedding the Think Dad mindset from the very start. So when you're inducting new staff into your service, this is the way that we work, this is the way that we do it. The language that we use the word dad. It sounds really simple, but if we go back to home family working, we know that there's gaps in provision. We need to be really clear, whole family, and that means mum, dad, grandma, granddad, and we go through every relative that could be within the family network. We deliver father and male carer inclusive practice workshops. I have a three-pronged approach to that. So we deliver in college and university to embed this kind of way of thinking before people go out into the workplace. We deliver to practitioners delivering on the front line, and we also deliver to managers so that we're really getting from every angle how to embed this way of working. Supervision is a great opportunity to unpick things, and quite often we talk about in Newcastle, we have a hugely female-dominated workforce. If there is a hesitancy or a reluctance to work with a man, supervision should be a really supportive environment to unpick some of that and work with your practitioners to make them feel supported and confident in working differently. And that leads into the cultural environment. Again, we are in a female-dominated world in this kind of work. So being really clear that actually it's not just about women, it's about men too. Next slide, please. And some of the benefits of changing the way that we work, because again, I'm going to talk about practitioners and what that looks like in practice, but quite often it's like, oh, I'm at capacity, is this an additional job? We need to understand that statistically, babies and children who grow up with a consistent positive male caregiver in their lives have better outcomes. And I struggled with this a little bit because I was like, well, mothers are great too, aren't they? But no, dads, men communicate differently, they play differently, they problem solve differently. And all of these things, the more that we saturate babies, children, young people with different ways of thinking and different experiences, it just makes their development and their way of thinking richer going forward. Also, emotional connection and confidence in social situations going forward. And for men, a validation, a recognition of their role and strengthening emotional connections, better mental health. well-being, and they're contributing to co-parent dynamics and have an opportunity to demonstrate positive male role modeling, which quite often we can interrupt generational patterns of harmful behaviors or norms that men might have grown up with, that this is the way that dads are, they might not be involved. Well, actually you can be, and let's change that, and let's change that for your children going forward. Next slide, please. And for families, shared responsibility, balance, share the load. I say that to my husband all the time, share the load. Support networks, strengthening families, attachments and connections, and multi-generational benefits, as I talked about before, passing on examples of how to be engaged and present father, and that is all right, that is okay, and we embrace that, and that can be passed on through generations. Healthy relationships, positive communication with men, emotional support, containment, stability, and the positive role modeling. Next slide, please. And for professionals as well, it's not another job, it's part of your job. But also, dad and paternal family can be a resource. So when you look at fathers who've been protective factors in serious case reviews, they've actually been the go-to. I worked with a family where it was actually paternal grandma who did all of the nursery runs. She was phenomenal. Without her support, and if prior dad had not been allowed contact with his child, and it had been a real struggle for mum to manage everything, and she was finding it really difficult. When dad had contact again, the whole of the paternal family was opened up. That child had access to hundreds of cousins, crazy sleepovers at grandma's at the weekends, and a really good relationship with her father as well. An opportunity for early intervention if a trusting relationship is built with dad from the earliest point. Improve skills and knowledge, and that enables us to be curious about our own service, about our own provisions and what we can change and what we can do better. Mitigates challenges and barriers when families are reluctant to share the dad's details, and dad might be the person who wants to tell you something or have a different perspective. He might be the person to say, I'm worried, there's something that's not okay. And he might be the person who also says, I'm available. I can take a child to a medical appointment that they might have missed. I can do the school run. When a child's accommodated in local authority care, an opportunity for them to connect with their biological family. And in the workplace, our dads and male carers who we work alongside, like, how are you? Don't just ask once, ask twice. We always say that. And do we need to explore cultural shift within our own organisations and teams of how we support the men that we work with? Next slide, please. So I want to give an example of change. The first lead-in that I want to give to this is that contractually we were asked to recruit 10 dad champions, the definition of that being professionals in services, particularly community family hubs, who would be the person who had that dad hat on and who would ask the question and who would look at their service critically and see what they could improve. We got 46. So we have 46 professionals working with us across the city from all different services. All of the information that we send out through our networks it goes right through children's social care. I think this is just really reflective because a lot of the information that we talk about, it sounds a bit grim. It sounds a bit gloom and doom. But actually, there's so much investment, so much passion behind this. It really excites me that we can change things going forward. We have a really close working relationship with the 0 to 19 team, which is midwifery, health visiting and school nurses. And they have basically created a new system that they use, and they are now able to create a record for a father. And they can record on this record for the duration that they're working with them and offering support. In the lead up to that, we were hearing examples of practitioners working with dad and, offering some real kind of support above and beyond what, say, a usual health visitor schedule of visiting would be. There was very limited places that they could write this down. There were, that was not communicated across other services. So the GP possibly wouldn't have been aware if it was a medical intervention, for example. One example that we had was supporting a dad to get his ADHD medication. And this shift has just opened a door. It's opened a door to connecting a father to their child. It's opened a door to enabling staff to offer that support. And that was the lead in for me. It's not the staff. The staff want this to happen. People want this change to happen. But it's the processes, it's the systems that we use that hold us back. But we also built those systems and processes so we can change them. Next slide, please. So that is a very brief overview of Newcastle and some of the way that we are thinking. We're really looking forward to researching if this different approach is benefiting on a wider scale services and supporting them. Thank you so much.
Thank you, Sarah. It really made me reflect on my previous role as a social worker and work that I did with dads, and yeah, that needs to really improve practice, but improve those systems behind that as well. So thank you for sharing. And we will now move on to Kieran Anders. So Kieran Anders is the Operation Manager at Dad Matters. Dads Matters offers universal and targeted approach to over 30 local authorities across England, and Kieran will be sharing some of the learning that has been taking place over the last 8 years on how to support dads.
Thanks, Anna. It's just me. I don't have any slides, so hopefully that will be okay for everyone.
Great.
I'm going to tell you a little bit about what we do at Dad Matters and where we came from. A little bit about where we're up to now and some of the learning that we've had, and why our approach does look a little bit different to a lot of other dad services across the country. So first thing first, in 2017, Homestart Host, who cover 4 areas of Greater Manchester, were working in collaboration with our early attachment service, which was one of the early attachment services to be embedded in CAM systems. They were providing peer support for families that was all aimed at under-2s for parent-infant mental health. Some of the gaps within that were evaluated by the Anna Freud Centre were around reaching men and reaching dads within those families, particularly with that in education, information, peer support, and actually guidance around what babies need from them. They got an innovation grant from the Health Foundation to really try something new, and that was where Dad Matters was born. We realised in consultation with around 200 local dads in Tameside in Greater Manchester that branding was a massive part of how they wanted to engage with the parent-infant mental health service. We co-produced the brand with them. We also realised that the places where they wanted to be engaged might not be where we expected it to be, and I'll talk about that in a little bit. And we learned that targeting professionals was a much better way for us to get dads into our service for one-to-one support, rather than trying to get to the dads as the only point of contact. So in the first year, we saw around 20 dads in referral, around 200 dads in a universal engagement, and I'll explain what that means in a minute, and around 200 dads in consultation for the build of the project, if you like, and how that looked. We worked with the early attachment service, but we also aligned ourselves with midwives and health visitors, perinatal teams and adult mental health services, local authorities and children's centres, and whoever else was around that were working in that first 2 years for families. So where we're at now is we have a full team of 11 members of staff in Greater Manchester, covering 10 boroughs or 10 local authority regions. Most of the funding comes through the NHS, perinatal mental health pathway, but we also have targeted funding through family hubs in 4 areas of Greater Manchester with varying hours for our coordinators. And I'll tell you a little bit about the numbers and the outcomes we reach there. We also share this model with home starts across the country. So there are another 20 home start schemes that deliver Dad Matters in their areas, from London to Bristol to Wales to Lancashire to West Yorkshire. There's a big mix, and we can let you know if they're in your area if you contact us through social media or search for Dad Matters in your area. It'll come up if it's there. So the model that we have really revolves around babies. We're not really a dad service. It does say dad on the tin, but we're all about babies and babies' outcomes. We know through our work with our clinical supervisors at the early attachment services how to support babies' outcomes when they have an involved, responsive parent who can be a dad or a mum. So we need to be able to support dads with understanding what that process is about, how those babies need them to act, and what it means to be a dad, the uniqueness of the dad role, if you like. We always focus on babies at the centre of the work that we do, because then dads are as important as mums within all of the services that we work alongside. So when we work with maternity or health visiting, if we're talking about outcomes for babies, because we're having positive outcomes for dads, then they understand what that will lead to in the future. And it is entirely early intervention for babies, but it is instant intervention for dads, particularly around early attachment. So understanding babies' needs, being responsive, managing crying, safe sleep, messaging, and then all of the other stuff that might come along with that in terms of substance use, social care involvement, mental health issues, and the like. While we keep the baby at the centre, we have some very specific things that we do. Our main priority is to get referrals of dads from professionals who see dads. And dads are seen across pathways in lots of places, just unfortunately not engaged with. So we get referrals now through very close links and training and offers with perinatal mental health teams, mother and baby units, infant mental health teams, prisons where prisoners are released, and we also do some work in prisons that we're piloting at the moment, from family nurse partnerships, teenage pregnancy teams, asylum seeking teams, SEND teams. There's a whole host of referrers out there that provide referrals for us, and a lot of that work is scaffolded by the work we do with those professionals in terms of attending team meetings, delivering training, providing resources, supporting in consultation, aligning ourselves within the pathway rather than being on the outside of a pathway trying to get dads out. We're within the pathway, essentially. So that leads us to the three kind of areas of work that we do. Our referrals are the main bit, and we use outcomes measures. In Greater Manchester, we use Core 10. In some other areas, they might use PHQ or GAD, but we have a wellbeing questionnaire that helps us to assess impact pre and post on their mental health or their well-being. We also use a parent-infant questionnaire. When we researched the parent-infant tools that were out there, they weren't really suitable for what we wanted. Some of them are validated, but they're not suitable antenatally, or you can't compare antenatal and postnatal. And there's a few other kinds of things that we looked at. So with our clinical supervising consultant, Pauline Lee, we created our own parent-infant questionnaire, which helps us to assess the knowledge of the dad in what babies need from parents, what babies need from them, which again helps us to assess pre and post the outcomes, the impact of that piece of work. We also use goal-based outcomes, where dads set a goal based on what they want to happen within the referral. We provide case studies, which are coordinators' words about what dads have done and what's been the outcomes. And we provide family journeys, which are much harder to get, but are written in dad's own words, sometimes with consent to share pictures of them and their children, which are very powerful. And we have some video case studies on our YouTube channel if you'd like to go and look at them. There's at least 4 on there that are really good, really powerful. They do talk about some triggering subjects like suicide, postnatal depression. So please look after yourself if you do go to watch them. But they're very powerful in terms of the work that we can complete with dads. What we know is to get those referrals in, we need to have really good relationships with professionals. So the second part of our work is engaging with professionals. We have dedicated professionals training, which is about 2.5 hours, that talks about what dads want, what they need from services, how they'll engage, what resources are available, how professionals can tweak their behaviour or their professional work to engage dads in a more productive way. A little bit about referral pathways. And that's a really great way of the professionals understanding what we're there for and how we're not replacing the work that they can do. We're adding a little bit extra into that and adding value into what's already in the pathway. We attend team meetings regularly. We attend events. We put on seminars. we just try and reach them as often as possible. We have a rolling program, a quarterly, of attending team meetings for our main referrers, such as perinatal mental health teams, parent-infant teams, health visitors, specialist midwifery teams like enhanced midwives or mental health midwives, and then others as well, such as social care, family hubs, early help, whoever that might be. And then the last part of what we do is the bit that we probably make the most noise about, because what we need is for dads to know who we are before a professional asks them if they want a referral. So we do universal engagement. This is where we go to places where dads already are. We go to places where they're thinking about themselves as a dad. So we're not talking about gym foyers. We're not talking about town centres. We're thinking antenatal clinics, scan clinics, particularly 20-week scans are a great place for dads to meet dads. We also go to neonatal units, mother and baby units, family nurse partnerships, antenatal education, and events that dads will be at. And when we can't be there in person, because obviously we can't be there all the time, we make sure we've got pull-up banners, we've got flyers, we're linked with the professionals at that site who can then give flyers to dads that are designed in a way that dads will engage with them if they're handed to them by a professional, and also if they're handed to them by mum because they haven't been at an appointment. And all of that work has been done in co-production with dads and also with our clinicians. So those are the three bits that we do. Nationally, we also provide training for the Institute of Health Visiting, and we've worked on the birth trauma inquiry as an expert witness, and we provide the voices of dads as often as we can nationally to try and influence policy and influence change, to bring dads' voices into the fore. So some of those numbers that I was talking about before, in Greater Manchester, we have 6.5 full-time staff that are doing contact work with dads. In the last quarter, so that would be April, May and June, we saw 128 referrals from professionals that totaled 1,288 individual contacts with those dads. 69 of those referrals were new ones in the quarter. 66% of those improved their knowledge of parent-infant relationships, and a further 15% maintained their knowledge. So they could have scored high on the questionnaire to start with and maintained. And then 83% improved their well-being, with a further 9% maintaining their well-being. Obviously, that's in Greater Manchester with 6.5 members of staff. So when we look at one of our family hubs commissions in Stockport, we have a full-time member of staff, 36 hours, costs around 52,000 for the year. In the last 8 months is the contract length at the moment. We've had 25 referrals. We've seen 515 dads in universal engagements, primarily antenatal clinics, but also those other bits that I talked about, like NICUs. And we've trained or had contact with 401 professionals in those 8 months. So when we look at universal numbers in Greater Manchester with those 6.5 staff, we've seen over 1,100 dads in 3 months in antenatal clinics, classes, NICUs. And each one of those dads is given 3 things. The first one is we ask them how they are. We're often the only person that asks, and we're nearly always the first person that's asked. But we're also really curious about the answer. There was a campaign a couple of years ago about, always ask twice, make sure that you understand what they're saying. What we try to say now is always ask again and again, because we can create situations where we ask more. So if we ask dad how he is, we can be curious about the answer in numerous different ways, and we can keep making sure that we're understanding. And so just asking at every point is really important. And for professionals, creating those opportunities to ask is also important. We also give them resources. What we don't do is have a flyer that says, if you're struggling with your mental health or you're struggling with parenting, come to us, we'll help you. Because that's actually feeding into that stigma for men. What we do with our resources is make them educational. We've created it with our clinical partners and co-produced it with dads so that it's attractive to dads, it's engaging, but also there's education in there around getting to know your baby before they're born, after they're born, understanding mental health, what to look out for, supporting your partner, icon messaging, skin to skin. Lots of really educational things that dads are going to want to read about. And then there's signposting and we signpost to lots of places. We don't want to collect the dads in and keep them. We want to make sure they find the right place at the right time. That might not be us. So we signpost to places like Tiny Happy People, Dad Pad, Best Beginnings, and then locally, Dad's Stay and Play groups, because we don't do stay and play groups, but there are plenty out there that are doing a great job. So we send them to, we signpost to them. Also, local talking therapies for perinatal parents. We have links to the self-referral forms and things like that on it. So there's a lot on there for dads to take away from that particular session. Some of the tools we use in that resource are make sure there's a space for dad's name on the front for a professional to write his name on. It could be us, it could be a midwife or a health visitor. They could be giving it to mum with dad's name on, and that makes it more engaging for dad when he gets home. There's also space for the professional's contact details. So for a midwife or a health visitor to say, if dad's got any questions, he can contact me here. That really helps dads then again to feel part of that pathway that mum's in. And then the third thing that they get is we talk about the baby. We give them facts about babies, about when they can hear in the womb, when they can differentiate voices, the benefits of skin to skin, the hormone changes in dad when they hold baby, and even when mum's pregnant. All of those kind of facts and conversation with dads really engage them in understanding that they have a role. What we learned in our pilot was that most dads in those situations are there thinking about how to support mum with this process. And what we try to do is help them to understand that there is a role for them that is unique to them and that is a parenting role and not a support role. So that's kind of the universal bit. And as I said, we saw over 1,100 dads in universal. 57 of those dads were in neonatal units, where we walk around the unit, we speak to the dads next to the babies, we ask them about the process, we feed back into services. We also feed back into places like maternity voices partnerships, service leads, to make sure that dad's voices are being heard in those service design and delivery as well. And in Greater Manchester in the last quarter, again with those 6.5 members of staff, we trained 233 professionals with a 4.95 out of 5 training score, which is a great score. And we had 877 professionals that we engaged with in team meetings, in team huddles, where we talked about our referral pathways. We talked about dads that they had on their caseload that they thought we might be able to support with. And so those engagements really helped to build in those referrals later on. So the types of referrals that we get are varied, but what we do know is because of the approach we take, we do get those dads that are less likely to attend a stay and play group or to reach out for support immediately, because they're seeing a health visitor who will say, we'd really like Dad Matters to give you a call. Is that okay? They're more likely to say yes to that, and we build a relationship with them from that. Those referrals include dads with autism, dads with ADHD, dads with physical disabilities, dads from ethnic minorities, dads that are under 25, dads that are school age. We've had transgender dads, non-binary dads, non-binary parents, should I say. We've had dads who are supporting mums on mother and baby units with severe psychosis. We've had dads who've had mums with severe postnatal depression in the community. We've had dads with postnatal depression. We've had dads with children who have disabilities or on NICU, or dads who are having limited or supervised contact with babies. And all of those referrals, we get a mixed bag all the time. We have case studies of all of those types of referrals showing that we really do reach dads that aren't often reached in an engagement structure. One of the challenges that we have is showing that what we do provides much more impact and much more support for dads than having something like a stay and play group. Having a stay and play group is an immense place for dads to go. Dads that attend those get so much out of it. But what we realized was in that model, having a stay and play group and reaching maybe 150 dads over a year, we can reach 50 dads in one day at an antenatal clinic if we hit the right day at the right time. And we can see far more dads with far more intervention in those places. And then we'll still see the same amount in one-to-one referrals later on. So our model is different, but we appreciate that actually we really do need to get dads into those group situations. Some of the things we provide are workshops, like our New Dad workshop. Anyone in the UK can book onto that through our website. We also have walk and talks or drop-ins or events in family hubs, or in museums or libraries or anywhere else that the dads want to go. We encourage our referrals to take part in those more than we advertise them generically to dads or universally to dads, but we do advertise them as well. And that's me, I think. I just wanted to tell you all about that. I think probably the only thing to tell you about is maybe a specific case study. We have a dad called Mike, and during lockdown, his partner was pregnant, and he didn't go to any appointments apart from the very last one. And the last one he was allowed to go to because he has autism, and the midwife made special dispensation to have him in the birth plan talk, so he would understand a lot more about what was going on. When baby arrived home, everything had gone pretty well. There was no trauma in the birth, but baby stopped breathing on his first night home, and Mike had to do CPR. This baby is fine now. I'd like to point that out. But Mike did suffer with PTSD. He did contact us and had some brief chats with one of our coordinators, but he stopped doing those and decided to end his life. The day that, at the time that he was going to leave the house to do that, the baby stirred, and he saw the baby stir, and he picked the baby up, and he'll tell you himself, his first thought was to quieten the baby so that it didn't wake mum up, so that the baby didn't wake mum up, so that he could go and carry out his plan. But as he was holding his baby, he realized that the relationship with the baby was there, that he was connected to the baby. And he says that the work that we did with him around understanding babies and communication really helped him to feel that connection in that moment. So he changed his mind about doing that, and he emailed us immediately that night and accessed more support. Mike then became a volunteer for us, and he started to run walk and talks in the park. He started to deliver outreach in the hospitals and speak to dads. And we would get dads who have autism diagnosis or thought that they may be autistic, and we would send them to walk and talks with Mike, which was amazing. Right now, Mike actually works for us in Greater Manchester. He applied for a job as a health inequalities coordinator, working with dads from ethnic minorities, GBT communities, young dads, and dads with neurodiverse conditions or SEND. And he's a fantastic advocate. You can see his story on our YouTube channel. We literally have hundreds of case studies, and they're all very different, and they're all very specific. And we would love to share them with anybody that wants to hear more about it. And that's me now. Thank you very much, Anna. I'll hand back to you for the rest of the day.
Thank you so much, Kieran. And yeah, it's so interesting and so insightful. And yeah, I can see we could be talking all day about the work that you've been doing at Dad Matters. And I think that was it in terms of putting this webinar together. There were so many examples and so much interest in working with dads and male carers. And this morning it's been great to see the different examples, but a lot of the common themes of really understanding and knowing dad and really changing that practice. And then it's moving on how we just embed that into everyday practice, where it's not a separate thing. It's just that this is that whole family working and family approach. But I am going to come to some questions. We've got some questions. We've had quite a few posted, and some have already been answered. But Kieran, there was just a quick one for you. You might have a chance to have a look, but I think there was a request for sharing the parent-infant questionnaire.
Yes, unfortunately, no, we can't share that with people in areas that we're not commissioned in, because it's our tool, and it's been created with our clinicians who commissioned us. So if you have a Dad Matters commission in your area, they'll be using it, and I'm sure that they could share that. But if not, then no, we can't at the moment.
No, thank you, Kieran.
I can tell you a little bit about what's in it. It's a statement-based questionnaire that makes statements about what babies and newborns need, and then the answers are true, false, don't know, maybe true, maybe not. And we score it so that we can use it as a pre and post evaluation. But actually, it's more useful as a start to a referral, so we know the bits that we need to work on with the dads.
Yeah, great. Thank you, Kieran. And yeah, for the question and answer section, I'd like to invite all the other panelists if they want to turn their cameras on. And I think Anna has put in that she would like to answer a question. Let me get to it. So what research has been highlighted that addresses the hormonal impact of the pregnancy hormones on the biological male body, and how it impacts their testosterone, sex drive, mood, etc.?
Thank you. Yeah, I had planned just to type it in, but ended up recording and then couldn't get out of it. So I got into Zoom loop. I just wanted to reference Anna Machin's work, so Time with Dad. So she's done some really great stuff on hormonal differences in different parenting and the impacts of that for fathers and mothers. So worth having a look at her book.
Great. Thank you. Thanks, Anna. And then there was a question about accessibility, really, of dad's groups. So the question is, I've heard about bacon butties being offered as an incentive to many dad's groups. Are we excluding certain ethnic, cultural, religious groups when we do this? I don't know if anybody from the panel wants to come in. Kieran?
Yeah, so it is a risk if that's the kind of group that you're setting up. But most of the groups that we come across that are doing stay and play groups, they are looking into their communities and they are providing what communities need. We work with a number of mosques who have dad's groups or dad's sessions, who run them specifically for those South Asian men. I think there is an assumption that, you know, if you put on a dad's group and it has messy play or sport play and you have breakfast included, that dads will come, and they will. Back in the Sure Start days, I used to manage a centre. We would do that every Saturday. We get 30 dads in. I didn't even need to tell the dads. I would just tell the mums and they would send the dads in. And so it really speaks to, are we looking to increase numbers of dads that we see, or are we looking to provide support for dads that need it? And there's a bit of a difference there, really. And engagement isn't the same as support. So having a dad stay and play with breakfast works to get dads in. That breakfast can be culturally appropriate if it needs to be, or the timing could be culturally appropriate as well. And we need to think about our communities when we're doing that locally rather than have a blanket kind of approach to it.
Thanks, Kieran. Anybody else? Yeah, and I think it's an interesting, like what you're talking about as well, that knowing the purpose of what you're setting up and why you're setting it up and who's your target groups, and thinking about that engagement as opposed to the support and those different pathways. But yeah, thank you, Kieran. I'm just looking up. So we've had a few questions about area specific, what's going on in different areas. And, you know, you can Google your area so somebody was saying about Rotherham family hubs. You can search for that support. On our website, we have regional implementation advisors. So I'm the implementation advisor for East of England, North West, and also Yorkshire and Humber. So you can contact myself and I can try and link you with family hub links. But yeah, in terms of those area specifics, it's good to, if you can do a Google search. So there's an interesting question about what work has been done to address when there has been domestic abuse and father is the perpetrator and mother does not want to provide details or have the father included due to abuse. How do we balance inclusion when father is not safe? And just interested in strategies. I don't know if anybody wants to come in. Sarah?
Hi, yeah, this is something that we've been looking into, and I wish I had a magic box that had the answer in. Unfortunately, I don't. However, that has fed into some of the work that we are doing that we hope to change going forward. Again, it's that huge gap in information with dad's details that really restricts services making direct contact, maternal gatekeeping, consent, all of that kind of thing. There's also the additional kind of guidelines from Respect around what behaviour change interventions can be done, particularly within the private family law arena. So because CAFCAS are no longer funded to do that piece of work, there is a significant gap there. And that's a question that I'm asking and looking at as to what can we provide in the community family hubs to support dads in those situations. And again, I think just embedding that message to mums and to maternal family that when we're asking questions about dad, where there is a risk, it's so important that we know who he is so that we can safeguard them.
Thanks, Sarah. And Kieran?
Just to echo what Sarah said, collecting data on dads and their details is the biggest barrier to us engaging with that dad in a meaningful way. There are resources out there to support that dad so we can make sure that he is safe, so he is assessed by social care. but the barriers of not knowing who dad is definitely the place that we need to start looking at to developing, because we can't do any more of the work until we know who the dads are. But there's also the mindset of, if a mum tells you that a dad isn't safe, that doesn't necessarily mean that the dad isn't safe. And but it's a really tricky kind of balance, because you don't want that mum to disengage with that service. We have this all the time from social care, who they want to refer a dad in, but they don't want to be seen to be supporting the dad, because the mum will disengage with the support or the work that they're doing. It's a real fine balance, and I think a lot of that is to do with the universality of details around babies is still really around mum, and if it's around the baby, and that's the way it always is, and there's an expectation that we will do that, but that's a massive piece of national work that I think needs to at some point happen, and hopefully the Anna Freud Centre can lead that. That'd be great.
Thanks, Kieran. But yeah, that it's such a balance. I know in my experience in working in children's social care, it's really difficult. But I think that bit about data and knowing who dad is and being able to make that contact as early as possible. I've rang dads when months down the line, and it's not good enough. And but thinking about that balance when there is a risk or a perceived risk. But Anna, would you like to come in?
Yeah, I just wanted to echo some of the points there, but also just mention there are some intervention programs nationally. I'm just thinking about Caring Dads, which was a model that was developed over in Canada and has come over to the UK. Again, some of the issues that we have is that it's a postcode lottery. We don't have that national investment in those kinds of interventions. So again, pushing for that national investment, I think, is really important. And the other thing just to say is that, and I know there's a question in the chat about people who are fathering outside of households as well. If we don't tackle perpetration of violence head on, the risk is that perpetuation of violence continues, and it might affect women who those men come into contact with later on. So actually, father inclusive support is also about engaging with risk, and being able to support those men as individuals as well. So I just wanted to make that point.
Great, thank you, Anna. And Kieran, you've still got your hand up.
Yeah, I did it again. I'm sorry. Just something to add to that. Obviously, we're talking about risk and dads being a risk. This happens in every conference and every meeting that we ever talk about. And I always like to say, we work with dads who are also victims of domestic abuse, financially, coercive control, emotional, physical, and the systems that are barring us from finding out about the dads that are risks are also keeping us from the dads that need that support too. And there's far less support for those dads out there. There's a couple of organisations that we link on our website that can give direct support, but it's not easy to do. We also find that a couple of examples, we had a dad whose partner had children removed. They left the children in situ because the dad was there to supervise the mum with the babies. But the moment that dad let mum take one baby to school, or one child to school, the children were removed again. And leaving that level of responsibility on a dad who is absolutely struggling with no support at all is definitely not appropriate. And that we need to think about really equalising what that looks like in families and services.
Thank you, Kieran, and yeah, a really good point about how making sure we know about those dads who are victims and dads who need that additional support as part of that whole family working. I am going to leave it there. There are some other questions that we've not got around, but I think we get sent a copy of them after the webinar, and if we cannot answer them, we will do. And there were some questions around support for training and looking at resources for all dads. And there was a question which I did answer about, is there an online community of practice? And because of the interest that we've had this morning, this is something that I'd really like to take forward to really bring people together to share what, continue this conversation and share what's working in their areas and those resources. So watch this space. And also, just as a leave, I think there is a slide to say we've got the National Centre for Family Hubs. We've got our national conference coming up, and that is looking at shaping the future of family support, and it's on the 16th of October. It is in person and also online, so it's a hybrid event. So if you are interested in coming, and I hope you are, then please follow the link, and the slides will be sent out to you. But I would just like to say an absolutely massive thank you to Anna, Ben, Jayne, Chris, Kieran and Sarah for excellent talks this morning. It's been really, really fascinating, insightful, inspiring. Thank you. I hope everybody enjoys the rest of their day. Thank you.